Now, I would like to invite on stage Dr. Bhaskar Bhatt. He had completed his BHMS in 1971. He is a true leader of NJH and a veteran homeopath from Gujarat. Managing trustee of Hari Charitable Trust, has also worked as authorized medical officer at ISRO. Please welcome Dr. Bhaskar Bhatt.
Good morning, friends. After lunch, it is good morning. So, hope you are all aware that we are going to talk till 5 o'clock, I think, or 5:30. I don't know, Doctor. 5 o'clock. Good. We have got a lot of hectic session in the morning, and many teachers. They talk very nice. Actually, though, there should not be any lecture after them. They deserve that credit actually. Many of them have talked very nice, and that is to be summarized. That is important. But part of being the NJH since long, I will first actually give my respect to Dr. Vishpala and Dr. Sarla ma'am. We learn a lot with them. I will say since 92, I know both of them. Dr. Salavan passed away in 96 and Dr. Vishpala passed away this year only for a few months. And they have given us a motto to teach, to learn, to see, to talk about homeopathy everywhere. And that's what we are, our team is working for that. And Dr. Kalpit, the latest member of the team, has done the marvelous job. That entire board actually is very happy about it. And you deserve it. You worked very hard within last 3 weeks. You had done everything so that 600 people nearly are listening this seminar. I will cut short actually. We will come down to start the slides. Actually, when I was asked about a subject, I said, what do you prefer? They said case is to be presented, and case is more important, and that too with the evidence. That is what Dr. Asrani suggested to everybody, that every case should be with the evidence. Bye. Thanks. So this case actually, this is a boy, 2 years old. He came to our clinic on 27 June. Next, he had come with a report actually, where it was written, in known case of left vesico-ureteric reflux grade 4. They have done this actually because of certain reasons. Our elder child had got the same problem, he was operated. So the second child, he has got the same problem, so they came with this report. When patient was 5 months old, he had a sudden high grade temperature. Brother's experience was the same. There was a problem in the urination. They went to the doctor, undergone the sonography, and that was diagnosed. Then actually, next, this is the report actually of 26th May 2011. And then doctor said, okay, he has got a left kidney, thick wall pelvic calcium system, mild fullness of the pelvic calcium system, and left ureter present. They said this can be some problem with the ureter development. You should go for MCU examination. So next. So this was the second report they have done in the same 20 May 2011, and diagnosed grade 4 left vesico-ureteric reflex. Urethra was normal. Now what is, you should understand what the problem is. The ureter is normal, urethra is normal, but from kidney to bladder, the ureter was not developed. That tube was almost short or not working. And they say the urine go back from the bladder to the kidney. In long run, it can create problem with the kidney, or kidney might, you have to remove it actually if it is damaged much more. So with this, next. So again, when they came to me, I said, "Well, go get the report again. Let me see what is the, within last 1 year what you have done." They have come on 2012 actually. So again they say, left vesicular-ureteric reflex, no change seen in the extent of the reflex on left side compared to the last year's X-ray. So the situation was the same. He was getting recurrent infection. Friends, listen actually. Listen. See, most of us, or the entire board and the senior people, they don't need these things. It is meant for you. The reason is, we would like to tell you that homeopathy is a wonderful science, extremely beautiful, beyond imagination. It is a science where you are living with it. People are practicing, and homeopathic doctor is not practicing, he is living with homeopathy, day in and out. From morning to next morning, 24 hours, he lives with the homeopathy, and that's the difference. So our science is such a science where you have been admitted or studying in the colleges. Think differently, that if you are a right good homeopath, it's an achievement of the life. Next. So USG report which we had seen, grade 4 ureteric reflux. He had been given antibiotics and treatment with just infection was controlled, but there was no change in the reflux. Doctor suggested to wait till 4-5 years old, and then if need, surgery is the option. Now, for next 3 years, recurrent urinary tract infection itself was a problem. Urination was a problem. So they say, okay, let's try for homeopathy, because the elder son, he was under my treatment earlier for the same problem after operation, and he was cured actually. Next. So at present, when he came to me, no fever, frequency of urination, dribbling of urination, he has to go 2 to 3 times to clear the full bladder. So within, when he goes for urination, the bladder was not emptying. It took 2 or 3 or 4 times within that 5 minutes or 10 minutes. Then he can empty the bladder. Other symptoms were dry skin, particularly in winter, it bleeds. They have consulted skin specialist for this. He gave some medication, ointment. He is not asking for the food, and if given, he eats. If mother speaks loudly, he fears, and then he will eat actually. Otherwise, he will say, no, I don't have appetite, or he won't eat actually. The cases that we are presenting over here, all detailed cases are not expressed over here because the case taking is 2 or 3 hours. We'll cut short to the point which are needed. Next. This is the diet schedule. Milk, dal, rice, roti, sabji, dal, milk and nasta, roti, sabji, and milk. Next. Appetite is normal. He likes fruits, salted pista, raisins, aversion to sweet. Though he is Gujarati. There are Gujarati people who don't eat sweet. Boil is 2 times a day. It is hard and then soft. Thirst normal. Urination 5 to 6 times a day, but he wears diaper because of the reflex. Next. Good. Profuse perspiration on the head and face. Sleep 11 to 8, even 2-3 hours in the daytime. He changes the position in the bed at night. There are cracks in the winter in the ear. Epistaxis in summer. Tongue normal, skin dry. He likes open air. He wouldn't like the covering actually, even in the winter. He's a outpatient. Next. This is the investigation we had just seen. Next. In the past, the skin was treated with some ointment by the doctors. He had gastroenteritis in April 11, admitted for a day, treated with allopathy, and there they found out that he is allergic to Septran. He had been operated for circumcision for phimosis. So that's another symptom which was important to me. That is, after birth, within a year, he was operated for phimosis. Next. Birth history was normal, 3.5 kg. All milestones are normal except the talking is less, speaks only few words, aneurysm is present. He is having habit of clinging to the teddy bear while asleep, which is very common in most of the kids. Next. Father is a computer engineer, mother is a housewife. He has got one brother who had the same complaint. He was operated for the same, and then he came for the treatment because after operation also the child was not comfortable, and we treated him. So this time, when they get the news that my younger child has got the same problem, we'll first go to homeopathy and then we'll think about the operation. There are so many diseases in the family: TB, cancer, rheumatism, diabetes, skin disease, kidney problem to the brother. So from miasmatic point of view, multiple miasm may be working, but one of them is stronger or active. Next. Patient is obstinate. If he don't get whatever he wants, he starts screaming. If given same thing afterward, he refuses and throws it away. If he is having his meal, anyone touches it or takes anything from his thali, he will throw away the thali. Don't touch to my thali. Gets angry easily, throws things in anger, though he is 2 years old. Whenever he is displeased, he sits in a corner, will not come back on his own. Then parents have to please him. बेटा आ जाओ बैठो, गलती हो गई हमारी, आप आ जाओ. बोलते कि ये सिलसिला कब से चल रहा है? पिछले 50 साल से बच्चों के लिए. पहले ऐसा नहीं था, माँ बाप मार देते थे. So this is, he needed a pampering or the calling. Next. He doesn't need much company to play. He likes to play with the toys like teddy bear, car, doctor set, etc. He can play for at least 15 minutes with one toy. He do not share his things with his brother. Instead, he will take away his things. So these are all his symptoms. He will take away the things that he like, possessive. He will fight. He will scream. उसको मनाना पड़ेगा. He won't agree to the things easily. He has got a fear of cotton bandage because once he was admitted to the hospital for some injury, तो वहाँ cotton bandage लगाया, तो he was not comfortable. Then since then, cotton bandage का नाम भी लेंगे तो गुस्सा करेगा. He had a fear of lizard, clay, golden color streaks, tattoos. He has got fear of all these things. Next. His appetite is better than the brother. His brother is more innocent than him. So this fellow is little obstinate and making plans to take away things from the brother. He is very fastidious. He cleans the floor after eating. If he passes urine, he cleans on his own. Though he is 2 years, remember. He keeps all things at a proper place. Brother is reserved, but he takes time to mix with stranger. But he knows and he mixes very well. He fights back when anyone beats him. He bites his brother occasionally, whips when his friend takes away his things. He never stays alone. He always needs one of his parents. Even if he is playing at neighbor's place, he will come at 5 minutes to check whether my mother is in the house or not. So if going out actually, every 5-10 minutes he will come back, he will see it, whether mother is there or she has gone out. He is moody in learning, will pay attention only if he is in mood or he won't. He protects himself for getting hurt. He will sit down and jump, take care he is not getting hurt. He is very cautious, taking care of himself. He likes music. He copies the dance from seeing the television. He has got a habit of biting the soft toys. He will keep on saying mummy, mummy till he is awake in the morning. He enjoys rides. He is more attached to father. He likes the company, likes guests, social gathering. Next. So I took the family history of the mother. Marriage in 2001, first delivery 2004, second time conception, but MTP was done. They never wanted a second child. It was not planned. They feared same problem in baby. The elder child has got this same problem. So they said, let us wait. We'll go for the second child after a couple of years. So they had gone for MTP. There was a third time conception. It was a planned pregnancy but natural conception, and the child was born in 2010. During 9 months, patient's mother didn't have any major illness. See, why I am showing you all these things is any case, it's a 2 years old child, yeah, 2 months old child, yeah, even 20 years old child. We are supposed to take history of the parents also, family also, his entire life also. Everything is needed when you want to prescribe. You should understand why somebody is sick, and that is important. At 8 months, she met with accident, mother, and 20 stitches were taken. At that time, she feared there may be any complication, but then everything was normal. She just had backache. At the end of her pregnancy, she just had mild swelling. And throughout the pregnancy, she had feared that the coming baby should not suffer from the same problem like the elder child. So repeated USG were done, and in the USG, everything is normal. Now why this case was I was interested was, there was one doctor, she is a homeopathic doctor. In 1991, she came to me when she was pregnant. And her father is a renowned gynecologist of Ahmedabad. In a routine checkup, 91 and 92, in the routine checkup, they found out that during the pregnancy, the fetus is having one-sided ureter development is retarded or not happening. And they said, doctor, let the childbirth should go normally, and then within month or two, we'll go for the operation, because this ureter is not developed. There is a same vesicular reflex. So that girl who is a homeopath, she came to me, sir, हम तो बहुत कहते हैं होम्योपैथी में कुछ कर सकते हैं. And I gave her medicine. Child was born after 2 months, and that child was normal. Still normal. She is now 25 years. The girl is, and she has got no problem since then. So she was treated in the womb, right, when mother was carrying. So I got that experience about this particular disease. So I was very sure that this child is going to respond to the medication. Breastfeeding till 10 months. Father's nature, polite, calm personality. Mother's nature, obstinate, angry easily if things are not done according to her wish. Next. What we observe during these things is that this time the child is restless, talkative, though speech is not clear, keeps on speaking something, repeating the same word, obstinate, irritable, anger, screams, throws the things, bites others. He keeps his things in a proper place, do not share his things. Keep teddy bear with him always. You are more hurried than me. I was under the impression I am very hurried. Next. So I took all these rubrics and then found out Lyco, Nux, Timonium, silica, arsenic, calcarea, etc. So after seeing the chart, I don't think that the child fit in any one category or any one medication. Next, etiology has been defined as a theory of causation of any disease or a sum total of knowledge regarding causes. So the knowledge about the causes is more important. Why the child is suffering, what went wrong, what happened, and that was important to me. Every system of the therapeutic, allopathy, Ayurvedic, homeopathy, or any other system, they assert with conviction that for an effective and permanent cure, the cause of the disease or sickness must be eliminated rapidly, gently, and permanently. These words are applicable to all medical sciences, not only homeopathy. We know it because it is there in the organon, but it is applicable for all sciences. Every doctor, in allopathy also, in Ayurvedic also, somebody has got a diarrhea and goes to an Ayurvedic doctor, what he will see? Shu khadu do bhai. The first question is, what is the cause? If he goes to allopath, even though he will say, get the stool tested and let's see, tumne kaisi infection lagyo. So everybody is finding out the cause for the treatment. Next. So in this case, when two people in the family are having the same problem, I feel there is a miasmatic problem. This is not related to the temporary problem of the child, but the miasm is there in the family, which is running through, and there are many diseases in the family, almost more than 10 diseases. So I realized that I should think about this first, find out the miasm which is causing problem, and should treat it. Then and then patient can be cured. So how to differentiate that miasm, which miasm is working? And as such, organ says there is psoriasis, syphilis, psychosis, 3 miasms, and then carcinosin was added, tuberculum was added, and then now Dr. Rajan Shankaran added 5 more miasms. We have got 10 miasms now. But basically, 3 miasms that Hahnemann gave still holds the limit of 90% of the diseases. All 2 other miasms, tuberculum and carcinosin, are playing role, but they are not according to Dr. Hahnemann, they are miasm. They are considered as psoriasis, syphilis, psychosis, syphilis, or carcinosin was part of the psychotic and syphilitic. That's the way. Or Dr. Hahnemann has written in the organon that cancer is a psoric miasm. And when we see the growth, we feel now it's a psychotic. And then when there is ulceration, which is syphilitic, we say this is a syphilitic miasm, turn out into a cancer. So miasm should be diagnosed in different ways. The first is by organon. Organon has given a list of symptoms of all 3 miasms by Dr. Hahnemann and then many other writers. Same thing, mental attitude, behavior and personality. I am not going to take miasm over here. So Dr. Mehta sir is there and I am too young to say anything about it. But mental attitude, behavior and personality are helpful to decide the miasmatic background. Third is family history, which diseases are running in the family. That indicates which miasm is running in the family. Then constitutional tendencies, and lastly the pathology that has developed. So I try to see all these things in this patient. Disease is associated with proliferation, infiltration of tissue, slow recovery, warty growth, gouty congregations, valvular disease of heart, delayed development of the body parts, and short-statured personalities. These are all physical appearance or physical development of psychotic miasm. If any 2 or 3 of these is present, it is a psychotic miasm that is causing problem with the patient. Next, even particularly in the psychotic miasm, retarded growth of the growth or development of an organ, pathology leading to inflammation, and then it lead to the uh, hardness of the tissue, tumors formation or growth formation, hypertrophy, exudation, indurations, neoplasm, metabolic changes, and all these things are aggravating in the damp weather. These are all sure signs of psychotic miasm. Till next. So in this case, I took it as a important part that psychotic miasm is playing a role in this family. Development of an organ is delayed, and antipsychotic remedy should be chosen. Next. So on 27 June 2012, Thuja 1M, one dose was given and SL was given. Child was told, mother was told, see if anything goes wrong, fever, cold, cough, anything that comes out, bring the child to me. Otherwise, stick to 4 pills morning, evening, SL. One dose was given in the clinic. Next. Next, actually, after a month, he developed fever. Temperature was 99. Thirst for little and frequent restlessness. And after Thuja, acute of Thuja is arsenic also, and symptoms are arsenic. We gave arsenical 1M, 3 pills in 1 cup of water, 1 teaspoonful medicated water every 2 hourly till fever subside. It was given for a day or two. Patient came after 10 days. Arsenic was once used. So again I gave Thuja because arsenic was given as a remedy. So after that I wanted anti-miasmatic again. After 1 month, 22nd August, there is no complaint. Frequent urinations continue. We wait with the SL. 17th September, again he developed fever. We gave Thuja 1 dose and arsenical 1 in water for 2-3 days. 8th October, she is better, the child is better. 1st November, Thuja 1 dose was given because they were going out, and SL. 3rd December, SL. Next. 27 December, they were going for some tour actually. So parents said, Doctor, oh, તાવ વાલી વાત આપી દો ને તાવ માટે જો બાય ચાન્સ તાવ આવે તો એ જ દવા આપી સવારે બીજું કંઈ આપવું નથી. So we gave SOS arsenic and SL. 29 January, he was feeling better. We again repeat the Thuja after almost 3 months. In the 13th February, mild fever, we gave arsenic, but said if fever subsides on its own, don't give it. Otherwise you can give. 1st March, there was some colic, not serious. Again I repeat Thuja. 30th March, better, weight was increased, 1.5 kg in 9 months, which was not increased since last 6 months when he started the treatment. So that is a sure sign that he is improving. 12th April, SL. Next. 15th May, fever, cold, cough, but not with the urine problem. Again I gave the same Thuja and arsenic, Thuja 1 dose and arsenic carbonate water and SL. Then I said, now it is 1 year, go for the report again, and then we will see whether medicine should be continued or not. So the report. Next. This is the 29th May 2013, after 1 year. The comments, normal MCU examination, posterior urethra shows no change as compared with the previous study. Left vesico-urinary reflex seen in the previous study has regressed. On present study, no reflex can be seen. The child is absolutely normal since then, and still today, this Thuja and arsenic was enough, and he has come out of that. Last, so, dear friends, miasm is something. I will talk for 2 minutes more actually. I hope, who is next? Right. I had always seen in my patients that every patient has got some or other background, either in the family, in his personal life, they have suffered, or they have got tumors, or they have got some warts, recurrent infections, or history of tuberculosis, or history of some other problems, baldness, loss of hair, or loss of ulceration in the mouth recurrently. So these physical symptoms and mental state definitely help you to find out an active miasm in the family, and there are not less than 30-40 remedies for each miasm, as a chronic remedies, as anti-miasmatic remedies, and they are always useful in acute case or chronic case, always. Gradually I have learned that there is, Dr. Henneman had written somewhere that in the world he is the only person having no miasm. Everybody has been having some miasm. That's what Dr. Henneman has suggested, written somewhere. Hey, sorry, yes. Yes, sorry. Psoriatic severity was diabetic. And since then, I am using anti-miasmatic remedy as an intercurrent in so many cases, otherwise also, even in acute cases or chronic cases. And I will say that it worked wonder. And people are shocked, sir, 4 दिन से बुखार नहीं उतरा था, आपके पास आए 2 दिन में उतर गया, या बार बार बुखार आता था वहाँ, और आपने जो दवाई दिया तीसरे दिन तो वो पेशेंट ठीक हो गया. So this is worth learning. We must study things in a detailed way of the case as well as mathematical organon, and that's the only way we can go ahead with homeopathy. And last thing, I will talk to the students actually. I will consider you people to be lucky one. When we were studying, the first seminar I attended in my life was Bombay ka conference in 1982. But as I was the chairman, if you remember, that SMA conference, that was the first conference I ever attended after 4 years of practice. And you people are listening the giant people at the age of 1920, which we heard at the age of 35. So there's a vast difference. You have got opportunity, computer is helpful, books are available, teachers are available. You have to ask them, sir, explain, and you will learn. You have to learn how to explain, how to learn. वो उनसे पूछो अपने टीचर से, सर दोबारा समझाओ, till you are satisfied that what is miasm, what is organon, what Dr. Susceptibility, Dr. Mehta sir has said, or some other people have said. Dr. Praveen Kumar has got wonderful peculiar symptoms or cases which is worth listening. So listen everybody, everyone, whoever is talking, try to see what is there and learn. That's the only way we'll go ahead. Thank you very much. Thanks.